In the middle of finals week, several universities across the U.S. are going virtual.
And it's all because of concern over rising infections. Cornell University is the latest school to send students home after more than 900 of them tested positive for COVID over the last week. This comes despite Cornell's high vaccination rate. More than 98% of its students are fully inoculated. So joining us now to talk about the fight against COVID on campus is Michael Kotlikoff. He is Cornell University Provost. Provost Kotlikoff, thank you so much for joining us on Quick Take. If you could start us off by just walking us through your thinking on pivoting to virtual learning right at the end of the semester. Was there a threshold or a cutoff number that raised enough eyebrows for the school to say, okay, this is when we go virtual?
Sure. Well, I think it goes back to Thanksgiving when we saw students return. We had the somewhat expected and usual spike in cases. However, that spike kept going up, and we were increasing at roughly 50% of cases every day. And that alarmed us, and we began to see a pattern of infection that was different than what we had seen before. We had prepared with a test that's a proxy test for the Omicron variant, and so we analyzed a number of the samples, and we saw a very high percentage of these cases were associated with this S gene dropout or the proxy for Omicron. So that told us we were dealing with something different, and we needed to do something different to stop the rise.
What is it looking like on campus, though? Are you seeing more and more students getting super sick? Has anyone gotten hospitalized so far? Or so far, is it infection rather than illness?
Yeah, great question. No student has been hospitalized at Cornell since the beginning of the fall semester. So it's all primarily mild disease or asymptomatic disease. But of course, if it spreads, and it spreads throughout the student population exponentially, we want to control that so it doesn't affect so many students that the chances of serious disease go up.
So what does that mean in terms of normal university operations? Campus facilities are closed, and finals that are normally taken in person have been moved online. But are students allowed to still gather, or do they need to socially distance? What does it look like on campus in terms of what people are allowed to do and where they're allowed to go?
Yeah, we as you say, pivoted to online for our students. The dorms are open, our dining halls are open, although we're doing more grab-and-go food to try and decrease the crowding. There's social distancing, mask wearing. We're allowing students, of course, to leave if they've been tested within the last 48 hours, so we know that it's safe for them to travel home. But the university is operating, offices are open, our laboratories are open. This has mainly been an infection in our student body, and that's what we wanted to make sure that any student gatherings, any activities that involve particularly undergraduate students, we stopped and made sure that we ended the semester safely.
What other big health restrictions are you going to put in to keep students healthy? Is there going to be a booster shot requirement coming up? And if so, how are you going to plan to monitor that, particularly since everyone can get their booster at different times? And I assume you also have a lot of international students who may not have access to boosters if they're going home for the holidays. So what will that requirement look like if you put that in?
Well, we've started already. We've urged our students to get boosters, those that are eligible, that are 6 months past their last vaccination. We've had several clinics on campus. We've provided information about where to locally get vaccinations. As we begin to think about the beginning of the spring semester, Cornell starts, as you know, a little bit later than other universities, so at the end of January. We'll make the decision about boosters in the next several days and be communicating that soon. And that is we'll make the decision about mandating boosters over the next several days.
Gotcha. But at the same time, you are encouraging students to get boosters if they do qualify. And Maddie brings up a good point. It's something she and I have talked about, which is that people tend to get a little bit reluctant, maybe even lazy and complacent about getting their boosters because it takes time out of your day, you're already inoculated, you might have a negative reaction, and who has time for that, particularly before the holidays? Is there anything that you can do, the school can do, to incentivize students to get their booster shots if they qualify?
Well, I think the biggest incentive is mandate, and it's something we're very seriously considering. Any mandate would need to be a rolling mandate because many of our students had their second vaccine in August or September, so they won't be eligible until well into the spring semester. But what we're really trying to do is make sure we get as immune and resistant a population as possible. And of course, the sharpest tool in our toolbox, really, the most effective tool, is getting people immunized and then boosted. And there's now emerging evidence that that's protective against the Omicron variant, which has spread so rapidly on our campus.
There is, and I hate to be kind of a negative Nancy here, but unfortunately, breakthrough cases are just increasingly common. Even among people who are double inoculated, triple inoculated with boosters. So at what point do you envision the school kind of accepting this as the norm, just like the flu? Students are going to get sick no matter what. So when do you think you'll make that transition to sort of an acceptance that this is just par for the course?
Yeah, it's a very good question. Right now, as I said, we've had very little disease on campus, but recently a substantial amount of infectivity. I think we need a little bit more information about the pathogenicity, the seriousness of disease associated with the Omicron variant. We know a lot more about the Delta variant. If, as initial reports are saying, the Omicron variant is less pathogenic, then I think we'll call the question that you're really asking, and we'll have to make a decision about whether we can live with this virus, and that also, I think, depends on our ability to treat individuals that get sick. And the other thing, of course, is that more of those treatments are coming out all the time. So we've been, I think, from the beginning, making our decisions based on the science and the public health of our community.
So spring semester, you mentioned, starts in late January. People will get to go home. The students will be able to go home for a couple of weeks. When they come back, Omicron could still be raging. That's plenty of time for another variant to emerge as well, and who knows what that one might look like. I know that no one wants to go back to the days of March 2020 where we basically shut down and all the students went home, but is there a plan in place for if that were to happen or if that needed to happen? Have you guys drawn up plans for what would be required for the school to shut down once again and close everything?
Well, right now we're working on our spring plans. And, the first thing that we really have to understand is whether it's safe to conduct classes, have students in classrooms, of course, masked in those classrooms and vaccinated and immune, but safe and not a risk of transmission. We've done a lot of the initial modeling around COVID-19 transmission, and we have a team on campus that's doing that modeling, feeding in the new data about infectivity of the Omicron variant. And so our first effort really over the next couple of weeks will be to understand the biology of this virus and then make the determination whether we need to de-densify our classes, whether it's safe to have all our students in class, whether we need to go hybrid. All of those decisions will be made in the coming weeks.
Well, speaking of, if I'm a student who's planning to go home for the holidays, I may hear this and think, okay, I'm not going to be in the classroom. I may not be able to go to parties. What's the point in going back next semester? Maybe I stay at home and save a little bit of money. What would your message be to those students who are going through that decision as they hear about going virtual?
Yeah, we've tried very, very hard to optimize the student experience from the beginning of this pandemic. So you may know Cornell in the fall of 2020 had all of our students come back into our residence halls. We conducted a safe semester. We had many of our classes in person. The spring semester, last spring semester and this fall semester, we've been at full density and had our our students in class safely. Again, no disease. So I really think that the residential campus experience for undergraduates particularly is a precious time, and we're doing everything that we can to make sure that we optimize that experience for those students.
I'm sure that our Cornell alum here agrees with that.
Yes, obviously. There's nothing quite like being in Ithaca in January or February.
I'm sure the students are itching to get back, Michael. Really appreciate you joining us and breaking all of that down. Thank you so much, and hope you all stay safe. That was Cornell University Provost Michael Kotlikoff joining us.